Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Ozzy and Dr. Arazu Nasiri show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Well, today we want to talk about one of the big reasons that implants fail that often goes ignored.
Great. Let's talk about it.
And it has to do with your gums. Not necessarily the bone, but with the gums that surround the implant. Most people probably don't know, but we have different types of gums. We have attached and non-attached gums.
Right.
So attached gums are like what's on the roof of your mouth. It's like very tough and it's kind of stuck to the bone underneath.
Yes.
It doesn't move around at all. And the non-attached is like stuff that's like under your tongue, let's say. So when you move your tongue around, the gum actually moves around with it versus the gum that's on the roof of your mouth that's like pretty tough and
Held
immobile.
on.
It's stuck on. So for implants and for teeth, really, to last, you need a band of that attached gum around the implant. And a lot of times when teeth are missing for a long time, the body naturally gets rid of that attached gum. And then when you place an implant, you don't have any of that. And that gum is like really important. It's like a rubber band around the neck of the implant, and it stops bacteria and stuff from getting under the gum.
So when you go to the dentist and the hygienist goes around poking around writing down numbers, they are looking at this collar of tissue, and then the stop is where the attached tissue starts. So they're putting their little measuring stick in there to see how much of the collar of the gum tissue you have, and it's the attached that stops it. So if you don't have any attached there, that little instrument would just go through. You would have a really deep pocket,
Exactly.
which is a huge bacteria trap.
Exactly. And that collar, like you say, it's like a rubber band, kind of like grabbing around the neck of your tooth or your implant. And a lot of times this goes totally ignored in implant placement.
Right.
So this is a big reason why implants fail. And the tricky thing about it is they don't fail right away because of this reason. This takes like a few years, but it will really decrease the lifespan of an implant if you don't have that band of attached gum around the implant.
Because infections can happen, bacteria is trapping there all the time,
Yeah.
so slowly that it degrades that bone.
Yes. And it's really important for your dentist to know this because it really matters how you place the implant about how to get this gum. So first of all, it's been shown that implants need to go a little bit below the bone, maybe a couple of millimeters below the bone, because then now you're giving space for that gum to form. So if the implant's already above the bone, the gum has to like form itself around the implant rather than just being able to form over it.
Got it.
So going a little bit underneath the bone really helps that. And there's also another concept called an emergence profile. So an emergence profile is basically like the shape of the tooth coming out of the bone. So you don't want it to be like coming out at a very sharp angle, right? Because that's really hard to clean. And you also don't want it to be like coming out straight up and down, because then you're gonna have bacteria traps. So you need to find like a nice emergence profile which mimics the emergence profile of a tooth.
And of the adjacent teeth, really.
And of the
So
adjacent
if you
teeth.
have some teeth and you're missing one,
Yes.
we're really trying to place that implant in a position where the gum tissue is going to form similar to the gum tissue of the neighboring teeth.
Exactly. And the emergence profile is important for this gum to form, because if you are pushing really, like if the implant crown is coming out at a very sharp angle, like coming in close to the bone, there's no room for this gum to form, this attached gum that we're talking about. So we need to like give enough space so the gum can form, and that's why you need to go a little bit below the bone when you place the implant.
Because the implant is there, and then there's like the neck of your tooth, and
Exactly.
then it's the crown of the tooth that sticks
Yes.
out. So it's that neck portion that is buried in the gums but
So
not
important.
in the bone.
So important.
It's really like 3 levels of where your implant
Exactly.
is.
And the
Implant,
neck
the
portion is the abutment portion. So
Yes.
that's what a lot of people also like, maybe it's confusing, like all these different parts. But basically the implant is the part that's under the bone. Then there's the neck portion, which connects the part that's under the bone to the part that's above the bone, and then there's the crown portion.
Yeah.
And the neck portion is so important, and it's often ignored by most labs and most
They're
dentists.
not measuring so it's one of the things that matters is the thickness of the gum tissue
Exactly.
that's existing. So for
So
example,
important.
like you might have thinner gum tissue in the lower sort of back molars, and you might have a thicker amount of gum tissue in the front or something. And measuring that gum tissue
Yes,
will determine how long to make the neck piece.
exactly. And the neck piece has to be long enough so it comes above that gum tissue just slightly, or maybe like equal to that. And then from there, the tooth emergence, and that's where the emergence profile is. And by having all these things correctly placed and correctly measured, you're way more likely to maintain that band of attached gingiva that's gonna like really, really affect the long-term stability of the implants.
And the aesthetics of it.
And the aesthetics, absolutely, especially in the front area. That's one of the big issues, is that you end up with these long teeth. Why? Because there's no gum coverage. There's no attached gingiva. So now you have to make the tooth longer, so so you're not showing some metal up there.
Right. So
Yeah.
that's really difficult. And so sometimes with implants in the front, even though you have bone, but if the bone is kind of indented up or in a little bit, that means you have to place the implant in a different location. It affects the emergence profile.
Yes.
So often we have to go in there and do grafting and wait,
Yes.
trying to rebuild that gum tissue similar to the adjacent teeth and
Yes.
the bone before you place the
And we even want to maybe overdo the gum tissue, because the gum is really easy to get rid of in a way. Like if you push on it, it'll go away.
Right.
So it's so easy and so fragile. So, and we need it, okay? So it's sometimes better to like maybe create more gum tissue. So sometimes we go in, we do some grafting, we add gum, we add bone, we let all that heal. Now we have like a nice volume of bone, and we have this thick gum tissue. And now we go ahead and place the implant. And then with the final crowns, we reshape the gum,
Yes.
because the gum's gonna just shrink away from wherever we put pressure on it with the final crowns that we place. So it can be like multi-step, but this is what ends up giving you like a good crown with good aesthetics that's gonna last a long time.
Yeah, for example, like in your front teeth, if you look at your gum is scalloped like this if you look at your top teeth, right? But when you lose a tooth, the gum just levels out flat there.
Exactly.
And so when we put an implant there, now we don't have that scalloped shape. So often we're making a temporary crown that actually pushes into the center of that gum area. So then your gum kind of shrinks away in that area, and we recreate the scalloping effect. And then you
Yes,
get your implant
and then you
crown.
get your implant crown, and then it's already shaped like that.
Yeah.
So again, it's just multi-steps to get to this nice gum tissue that's got the nice thickness around the tooth and right shape. And this is a big reason why implants fail, but it's often ignored, especially in the back areas. I want to say in the molar areas, it's where it's mostly ignored, because no one's looking at the aesthetics that much there.
Right, and maybe the aesthetics don't matter as much, but having that scallop also helps with food trap, because our teeth are sort of shaped in a way that they're triangular. So if you have an upper tooth, it's narrower at the top and then it comes out. And so the scalloped gums fills in that sort of little triangle of
Yes.
space between sort of the roots of the teeth. And so in the front, it's an aesthetic issue. If you don't have that, it almost looks like you have a black hole, like
Right.
you have a seed stuck between your teeth, right? But in the back, it might not be an aesthetic issue, but it's still a food trap issue.
It is. That's another thing where sometimes the teeth are touching each other, but the gum space is too big. So
Yes.
now you're getting food trap. And that's again because there's not enough of that attached gum. There's only that movable gum, which easily moves around. Food gets in there much, much easier. So there are solutions. There's grafting of the gums, or you could remake that neck part to allow for more gum to fill in. But you have to have a dentist who can like really look at these things and analyze, is it the gum? Is it the shape of the neck? Was the implant placed in the proper position to begin with? Because if the implant is like coming out of the bone, there's nothing you can do. It's already like in the wrong place to begin with.
Or if it's not centered, like if you have a space between two teeth and you place the implant more to one side than the other, then that emergence out of the one side is going to
Yes.
it's going to create a bigger kind of gap
Yes.
over there. We can't. Our crowns of our teeth are not boxes. They don't fill they're not like a square.
Right.
They come out in this kind of like oval, rounded shape.
Yes.
So you're always going to have these spaces at the gum line, these triangular spaces. And
Yes.
that's where the attached gum tissue
is really important. But I've seen it even with big spaces. If you do have good attached gum, you won't get a food trap. But even if you have a small space and you have no attached gum, you will get a food trap.
Sure.
So the attached gum is really like the savior of all these mistakes, maybe. But it's really important to have it. And as you're like, looking for dentists who are doing implants, this is something that your dentist should be looking at, is how are your gums in those areas? Do you have enough attached gum? Do you have enough volume of gum? And then that's really going to create the best long-term result for the implant.
It's an issue when people are price shopping, right? Oh, come here, we'll do the implant for $1,000, $2,000.
$395.
And then you come here and we tell you we have to do a graft first, and then we have to wait, and then we have to do this.
Yes.
And then people are like, well, why is it so much? And why do I have to wait 8 months, for this to
Yes,
happen?
yes.
Because we're waiting for the graft to heal, and then we're placing the implant, then we're waiting for the implant to heal, then we're placing it. And then you go next door and they say, what, $395? We'll place
Same
it
day.
today, and you can walk out the door. And so you're not really comparing
Yes.
apples to apples. And there's dentists out there who don't even understand or know about these concepts, let
Yeah.
alone be able to offer them as a service to you at a reasonable price. So,
Yes, the gum thing is definitely overlooked by many dentists who are practicing.
Sure.
And it comes, I feel like, with experience, because as you see these failures and you analyze, why did this implant fail? Like, there was enough bone, there was enough everything. And you're realizing all these different things have to work together in harmony for the whole system to work
yeah.
long term and for long-term stability.
It's a complex problem,
It is.
So find a provider who will take the time to explain and talk to you about this. I think one of our
Yes.
biggest issues is lack of time to be able to sit down with a patient and say, you know what, we need this attached tissue. Why does it have to be there? Why is it important?
Yes.
Why are you paying for this and waiting an additional 3-4 months, and having an additional surgery?
And
let's
yes,
say.
doing extra surgeries.
It is.
And yeah, and some people may not want to go through it, and I totally understand that, but know that the implant stability will be compromised
Know
if
the
you're not
repercussions.
having this band of attached tissue around the implant.
Yeah.
And I guess the literature has shown that the most best surviving implants have 3 millimeters of attached tissue above them. So going like to occlusally, when the implant is placed, you need to have 3 millimeters of gum forming over that. And that's going to give you the best stability long term.
So, this stuff is planned way ahead. It's not at the end stage. So it's like
Yes.
looking at your CT scan, figuring out if you have enough bone, figuring out what size implant can we bury so it's buried below the bone level.
Right.
How much gum tissue is already there right now? Do we need to do a surgery to add more gum tissue?
Yes. And some
So
of
all
these
these
things can be done in conjunction, but it does have to be
Planned out.
thought about. Yes, absolutely.
Sure. So if you want to get an implant and you want to have it done the right way, find a provider who'll talk to you. We offer free virtual consultations. You can go
Yes.
to our website, LA Dental Clinic, and come and see us in Los Angeles.
Yeah. Bye.
Bye.
Thank you for listening to the Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.